The Nova Scotia government has ordered a review after a man died waiting for an ambulance. This happened after the man's wife went public with her husband's story. The CBC's Michael Gorman reports.
It's a situation no one wants to find themselves in, needing an ambulance when one isn't available. This is what happened to David Benedict. A carpenter, he'd been diagnosed with primary progressive MS. He also had a kidney disease and received dialysis treatment at home.
You know, he was a very caring, loving person. He never dwelled on the fact that he had these two terrible diseases. He was always positive and upbeat.
Here's what happened, according to his wife, Carla Demel. On August 8th, Benedict has a severe headache and higher than normal blood pressure. At 5:30 p.m., Demel drives Benedict to Soldiers Memorial Hospital in Middleton. He's treated for a migraine, discharged, and they return home to nearby New Albany. The next day, Benedict finishes dialysis around 4 o'clock. Demel says he became disoriented and weak. She calls paramedics. EHS arrives in 15 minutes. They take him to Soldiers Memorial Hospital, where a doctor orders blood work, antivirals, and antibiotics. The doctor says Benedict should be transferred to hospital in Kentville for a CT scan and lumbar puncture. Demel was told an ambulance would become available around 11 p.m., but that was pushed back to 2 a.m. Just before 1 in the morning, Benedict is found partially out of bed. He's unconscious and unresponsive. The doctor tells Demel it was likely a stroke and she must decide about next steps. Knowing her husband's wishes, she requests palliative comfort measures. At 7 a.m., Benedict dies in hospital. He was 54.
I have a lot of anger towards the healthcare system, not the frontline workers, but these policy and decision makers.
A spokesperson for the health authority said the agency relies on its partnership with EHS for patient transfers. EHS officials say they're aware of the situation and looking into it. They say it was very busy with emergency calls during the time frame Benedict was waiting for a transfer, and so non-emergency patient transfers were delayed. Despite the rawness, Demel feels compelled to share the story.
People need to know what can happen to a loved one. Things need to change. Unfortunately, David passed away, and I'm hoping that this will not happen to anyone else, because our healthcare in Nova Scotia is in a crisis, and it needs to change.
Demel will get the written autopsy results in the next few months. Michael Gorman, CBC News, New Albany.
Nova Scotia's Health Minister Randy Delory sent the CBC a statement saying he's asked the Health Authority and EHS to conduct a review into David Benedict's death. His statement read in part, "Our emergency health system is dynamic and moves ambulance resources on a priority basis. There should be an ambulance available when one is needed." Joining me now is Michael Nickerson. Michael is the president of the Nova Scotia Paramedics International Union of Operating Engineers, Local 727. He joins me from Charlottetown, PEI, where he's attending a conference tonight. Michael, welcome to you.
Thank you.
What's your reaction to this story?
It's terrible, and our condolences go out to Mr. Benedict's family. It's absolutely tragic.
Okay, do you think the ambulance system is in crisis?
I think the healthcare system in Nova Scotia in general is in crisis, including the ambulance service. We've been sounding that alarm for close to 2 years now, and we're not seeing any improvements at all to this point.
I thought there was an announcement in June from the Nova Scotia government, 2 new policies that were supposed to make it faster for an ambulance to transfer patients and also make it faster for people to be discharged from inpatient beds. Has there been no progress?
Well, it's hard to say from our point of view. That would be a Nova Scotia Health Authority question, but what we're seeing and hearing is that there has been some improvements, but there's still ambulance delays, of course, and offload delays.
Yeah. What's your understanding of what happened to David Benedict?
Well, I'm not really sure. We're not privy to that information, so I don't know how busy it was that night. We don't get that information.
Yeah. Still, with the 2-hour delay and then another 2-hour delay, is that common?
Not that I'm aware of. And it shouldn't be common. I mean, we've been sounding the alarm. The government knows there's an issue, and they need to admit that there's an issue, and they need to start fixing it.
What should have happened in this case? Take us through it.
Well, I think an ambulance should have been dispatched and transferred the patient, obviously. I mean, unfortunately, we're dealing with a situation that somebody has passed away because there was no ambulance available for whatever reason.
Yeah. This is what Minister Delory said in his statement. I can only imagine what the family is feeling. I understand they have questions, and I have as well. This is why I'm asking Nova Scotia Health Authority and Emergency Health Services to conduct a joint review. What kind of questions do you think should be asked in this review?
I think there should be staffing issues, where the closest ambulance was, what the call volume was like that night, and specifically at that time.
Okay. What are the issues? What issues do you think is causing a slowdown in ambulance response time in Nova Scotia?
Staffing's a huge issue. So when paramedics call in sick or they're off on short-term, long-term disability or WCB, other paramedics are not picking up that overtime because they're wore out, they're tired, they're feeling devalued by not only their employer but also by their provincial government. And they're just fed up and they don't want to put in that extra time. And I can't blame them.
Okay. So what's the reaction to that? What's that causing in the system?
Well, it's causing lower number of ambulances available on the streets because of staffing. So when they can't backfill somebody who calls off sick, then there's less ambulances available on the road.
Okay. And how do the hospitals play into this situation? What's going on with the hospitals? In the emergency department specifically?
So with the hospitals in the emergency department, what's going on is the ambulances are arriving and they're not being able to offload their patients in a timely manner. So now they're also delayed getting back out onto the streets and into the communities.
Okay.
So that exacerbates the problem as well as the staffing issue.
Okay. This is an expensive issue. How do you think it should be fixed?
Well, the very first thing is the government has to admit that there is a problem within healthcare. If they don't want to use the word crisis, I'm fine with that. But admit that there's a problem. Let's get together, let's talk, let's come up with some ideas and figure out what will work for Nova Scotia.
All right. Michael Nickerson is the president of IUOE Local 727. Michael, thank you.
Thank you.